Hi everyone, my name is Madison Murray, and today I'll be walking you through my microbiology lab, investigating using the Kirby-Brewer method to study antibiotic resistance. This is one of the most widely used techniques in clinical microbiology, and it gave me some really eye-opening insights into how bacteria responds to antibiotics. So what exactly is the Kirby-Brewer method? It's a standardized procedure that tests how well antibiotics inhibit bacterial growth. This method is crucial in the clinical setting as it helps doctors choose the right treatment for infections and tracks resistant trends. And here's how it works. Small discs soaked in a specific antibiotic are placed on agar plates that have been spread with a bacteria. After incubation, you'll see a clear circular area around some of the disc. Those are called zones of inhibition. They show where bacterial growth has stopped. The bigger the zone, the more effective the antibiotic. This method is commonly used not in just hospitals, but also in agricultural and public health to help manage antibiotic use responsibly. Now onto the goals of my investigation. I wanted to learn how to properly perform the Kirby-Brewer disc diffusion technique, compare the antibiotic response to the two bacteria, E. coli and Staph, use zones of inhibition to determine antibiotic effectiveness, understand how gram-positive and gram-negative bacteria differ when it comes to resistance, and finally connect my lab results to real-world issues like antibiotic overuse. And spoiler alert, it was really interesting to see how much bacterial structure impacts antibiotic success. Here's a quick breakdown of what I use. On the antibiotic disc, I use batracin and tetracycline plus sterile control disc. The bacteria I used was reactivated E. coli, which was gram-negative, and Staph, which is gram-positive. Tools and equipment were swabs, forceps, rulers, cultural tubes, agar plates, and disinfectant like bleach and isopropyl alcohol. To start, I disinfected my workspace with bleach and gathered all my materials. I labeled one plate for E. coli and one for Staph. Then I swabbed each plate in 4 different directions to make sure the bacterial lawn was evenly spread. After that, I used flame sterilized forceps to place 3 discs on each plate: batracin, tetracycline, and the control. The plates were then inverted and incubated at 37 degrees Celsius for 48 hours. Once the incubation was done, I measured the zones of inhibition around each disc using a ruler. From there, I used the Kirby-Brewer chart to interpret the results and determine if the bacteria were resistant, intermediate, or susceptible to the antibiotic. So what did I find? Staph, which is a gram-positive bacteria, was much more affected by the batracin, and E. coli, on the other hand, showed strong resistance to batracin. That's because it's a gram-negative bacteria and has an outer membrane that blocks the antibiotic. Tetracycline worked moderately well on both bacteria, and as expected, the control dish showed no zones of inhibition, meaning the bacteria grew normally around them. Let's talk about why these results happen. First, the structural difference between gram-positive and gram-negative bacteria matter a lot. Staph doesn't have an outer membrane, so batracin can target its cell wall more easily. E. coli, however, has an extra barrier which gives it natural resistance to certain antibiotics. Tetracycline, which targets bacterial ribosomes to stop protein synthesis, is a broad spectrum, so it had a moderate effect on both strains. In my control disc, they did exactly what they were supposed to do, showing that the discs themselves did not influence bacterial growth. There are a few factors that also could have influenced my results, like the age of my bacterial cultures, my incubation temperatures and timing, whether the discs were placed evenly, how precisely I measured the zones. Still, I feel overall results were clear and consistent. So why is this lab important? In healthcare, tests like this help clinicians determine which antibiotics will actually work against the patient's infections. That means faster treatment, fewer complications, and less chance of prescribing the wrong drug. It also helps reduce antibiotic misuse, which is key in fighting back against the rise of superbugs and drug-resistant infections. For me personally, this lab hit close to home. I'm currently working as a pharmacy technician, and I plan to become a nurse and eventually a certified registered nurse anesthetist, or a CRNA. So understanding how antibiotics work and how resistance develop is a huge part of what I'll be doing in the future. This lab helped me connect classroom microbiology to real-world practice, and it reinforces the importance of careful drug selection, understanding bacterial behavior, and making informed decisions when it comes to patient care. Overall, this was a really rewarding investigation. I gained hands-on experience in the clinical technique that's not only scientifically fascinating, but directly relevant to the field I'm pursuing. Thank you for listening to my presentation, and I hope you found the Kirby Brewer method as interesting as I did.